Good morning. I'm going to do an Ezpap, and so the first thing I'm going to do is check the patient's chart to see if they have any nebulizer treatments that I can, if I need to take a T-piece along with me for an adapter, and then I need to knock on the patient's door, introduce myself, and then I need to check the patient's ID band and wash my hands. Before I begin any treatment, I always need to check the vital signs and then assess patient's lung, listen to their lungs to see if I hear any crackles in certain lungs and see if I need to approve anything like that. So the Ezpap here, it comes like this. It's going to be one that connects to an oxygen source. Each packet comes with a disposable manometer. So here I would set it at the appropriate thing where I need them to be at, the patient to be at. So I take off the clip. Then I place this on, and then you would need to place it to where, as for us as the respiratory therapist, so we can read it when they do their treatment. So we'll set it kind of off to the side, the numbers off to the side, so we can see where they are getting to. And when we are ready, then this one hooks up to an oxygen source, so we would hook this up to here. There's two little ports to hook up to. And before we connect it to the oxygen source, we'll just look over it to make sure there's no cracks. I don't see anything abnormal about it. And when we're ready, then we can connect it to the source. And see, like, you have to make sure it's tightly on or else it just does not stay on. And so every time you would do it at least 5 liters per minute. So before you begin, you would instruct the patient and let them know. So this is a treatment. This is going to help clear out your lungs. This will help opening them up and strengthening them to be able to help you cough and get those secretions out so that we don't cause any atelectasis, anything like that, alveolar edema, anything like that. So when we are ready, we can turn it on. 5 liters there. And so what we'll do is instruct them not to cover the end piece because that can cause that obstruction and it won't get the appropriate flow. It will also make sure everything is closed and there's not going to be any leaks anywhere. Make sure this is properly sealed, the manometers correctly placed on there. So you're going to have them hold it up like this and not to cover the end piece. You don't want them to hold it upside down because that meter is not going to read properly for us. So you're going to instruct them to take a nice deep breath in, and then you're going to have an exhale of 3-4 seconds like that, and that way they can get that good lung expansion when they do it. And so as they take their inhalation, then we'll need to make sure we see how far they're getting. If they're not getting to the appropriate flow, then we'll just have to start them at a different rate, and then we'll continue to work with them to get their strength up to be able to get that good inspiratory rate and exhale. And then, so like I was saying, if you have a nebulizer treatment, you can add a T adapter on here, and then you'll have a little medicine cup at the bottom for the nebulizer medication. And then you would have that. And if you don't need your manometer and you're just doing the Ezpap, you can take that off. But when you do, you need to make sure you have the port covered like that, so that way you don't have any excess air going out, and you know you're getting the appropriate flow to the patient. So you do this a few times and always give them a break, the 10 to 30 breaths per minute, so that way kind of let them breathe, catch their breath, and then do it again. And so when they're done, if they need to have them do a deep cough, that way they cough up anything. And if we need to take the sputum sample, have a sputum cup, and then we'll put it in there and chart down any specifications that it would have. So when you're done, you would shut this off, remove it from the oxygen source, remove the oxygen from your Ezpap machine. And so this, you would set it off safe and instruct the patient not to put it in water or anything to wash it, as it can harm the valve that's inside there. And so and when you have this is a disposable manometer, so that you can just get rid of that when you're done. And with your cord, and then you just set this in an appropriate place, in a safe place, and that way you can use it again for the next treatment in the next hour. And so when you are done, then you reassess the patient, check their vital signs, listen to the lungs, see if the treatment is helping loosen up those secretions, And then you go chart on the patient's chart if they had any cough up, any secretions, and if it was working, and chart down the vital signs and let the doctor know.